Hello everyone! Female health is always an important topic to tackle. Lately, there's an increased awareness about women's health, especially about cancers. Breast cancers and gynecological cancers such as cancer cervix are two of the leading causes of death among women. The World Health Organization launches huge campaigns either offline or online to spread awareness about these types of cancers. A huge number of women can be saved if only they know the symptoms and know how to examine themselves at home first. Today we are going to talk about gynecologic cancer. Our role today is to answer most of your questions regarding gynecologic cancer. We have Dr. Kim, who is a leading doctor in Ewha Mokdong Hospital in Seoul. I'm Uma, and before we start, please subscribe to our channel so the next time you will be updated with our new releases. Hello, Dr. Kim. Nice to meet you.
안녕하세요.
Dr. Kim, what is gynecologic cancer?
Gynecological cancer is cancer that affects a woman's reproductive organs, such as the uterus or ovary.
So what are the risk factors that helps in developing this kind of cancer?
Depending on the type of cancer, the risk factors vary. For example, the uterine cancer, or HPV, human papillomavirus, tends to be the cause. For endometrial cancer, the risk factors tend to be obesity, late menopause, or diabetes. For ovarian cancer, the cause is not well known yet, but heredity seems to play a role in up to 20% of cases.
So how to reduce these risk factors?
As I said before, since the risk factor for uterine cancer is HPV, there is currently a vaccine for it. For endometrial cancer, since the risk factors include obesity and diabetes, exercise can be a mitigating activity. Since most have bleeding at the beginning, it is good to have exams to verify. For ovarian cancer, heredity tests to see any signs are useful. If the heredity tests reveal likelihood, it is best to remove the ovaries prior to age 40 as a preventive measure.
So let's talk about the symptoms. So what are the symptoms for gynecologic cancer? Is it the same for all of the types or is it different?
The symptoms vary. Cervical cancer tends to not have many symptoms at the beginning. Generally, they reveal through a pap smear test. As it progresses, there is bleeding and pelvis pain. For endometrial cancer, there tends to be bleeding from the start. For ovarian cancer, there are not many symptoms, but lumps can be present in the area. However, many arrive for treatments when quite developed, and at that stage it is complicated by various abdominal pains and bloating.
So you talked about pap test. What is it exactly, and when should it be taken?
A pap test is used for screening, but is not a definitive test. A pap test is a test to screen the likely patients for cervical cancer. In countries like the USA, it is recommended every 3 years, while in Korea, every year or 2, as the prevalence is different.
So who should take the HPV vaccine?
HPV vaccines are recommended for those aged 9 and up to 50. Regardless of male or female. While everyone can take it, it is more recommended for those who are younger and do not have sexual experience yet, as they are not likely yet exposed to HPV.
Okay, so let's talk a bit about the treatments. What are the treatments available for gynecological cancer?
Generally speaking, there is surgery, chemotherapy, and radiation therapy. Regardless of whether it is uterine, endometrial, or ovarian cancer, the early stage treatment is surgery.
Okay. Can you just explain a little more about the minimally invasive surgery?
Minimally invasive surgery covers laparoscopic and robotic surgery. Unlike open surgery, in minimally invasive surgery, we only perform small incisions about 10 millimeters in size to utilize the laparoscopic surgical tools.
For the minimally invasive surgery, are there any indications or side effects?
For gynecological cancers, the minimally invasive surgery is used for early stage cancers. There are studies that prove the effectiveness is just like open surgery, especially for endometrial cancer treatments, so it is used quite a lot. For surgical cancer, studies tend to prove that relative to open surgery, minimally invasive techniques have higher recurrence and fatality. So now we explain to the patient the facts, and we tend to only use the techniques in early stages where the tumor is small. For ovarian cancer, many visit us when late stage, typically stage 3. So it is often better to do open surgery and remove all the affected tissue in the surrounding area. So we resort to open surgery.
Alright. So after getting the minimally invasive surgery, is there a possibility of relapse?
When we compare the results of minimally invasive surgery versus open surgery, if the cancer is developed or if the tumor is large, the results are better for open surgery. So from the start when deciding, we consult together with the patient. The minimal difference is when the cancer is treated in its early stage.
So after that surgeries, there are other options for treatment, right?
Aside from surgery, we have chemotherapy and radiation. The methods are used for developed cancers for overall treatments. Even after surgery, sometimes we use chemotherapy and radiation as supplementary treatments. For ovarian cancer, the standard is chemotherapy supplementation. For uterine or endometrial cancers, we sometimes, depending on situations, use radiation to supplement or chemotherapy, or both simultaneously.
So, in the case of a female who was touched by this kind of cancer, can she still have babies?
Depends on the type of cancer whether we preserve fertility. For uterine cancer, if we can save a part of it, then she can still conceive. For endometrial cancer, we use hormone treatments instead of surgery for those who want to conceive. For cervical cancers, 2 centimeters or less in size, the tumor can be removed and the uterus saved.
Okay. So my last question today is, can you please explain a little more what's so unique or what's so special about Ewha Women's University Gynecological Center?
Yes, Ewha is still known as a women's hospital, and thus any related departments are well established. Our aim is for patients to undergo surgery or treatments within a week of diagnosis. So we strive for accurate assessments and effective treatments in a speedy manner.
Thank you so much, Dr. Kim.
Sure. Thank you.
Yes, today we learned about gynecologic cancers. If you know and deal with symptoms of gynecologic cancers in advance, you'll be able to treat them before developing a large disease. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as we can.